and began the process of, frankly, ramping up incredibly fast to handle this pandemic. Unfortunately, it's a tale of two cities, if you will, in that absolutely outstanding performance by our clinical teams, whom I cannot be more proud of in terms of how they responded without hesitation and handled more COVID-19 positive patients than any other system in Michigan by far. But the other piece of that, by doing the most, we are also hemorrhaging the most in terms of cash, and we have to deal with that piece of the puzzle. We have a lot of our clinical teams where they do not have volumes right now because of surgeries essentially being all canceled or other services, and that we can't sustain it by keeping this large group on the payroll the way we have been up to this point. So we have to make some tough decisions. That's all shared with you in our press release. And again, this is very difficult for us. I did share with 38,000 employees this morning my take on all this. And in particular, I shared with them the fact that when I was growing up, I was in a family of 7 children, and my father was the sole breadwinner, and he lost his job multiple times. And so I experienced firsthand the difficulty and stress that can happen when these kinds of issues fall on families and individuals. It's not just the employee. There are a lot of people impacted by these. The only saving grace we have right now is we have an extraordinary window of benefit from the state and federal government providing unemployment insurance for these individuals. It's by no means perfect, but it's a heck of a lot better than certainly my father experienced or my family when we went through our times. And we are also committing that for all the employees, we are going to be providing health insurance to them as part of our program and continue that at our discounted rates. All of that is shared with you in the press release. And so with that, I'll conclude my comments and maybe open it up for questions.
John, I did want to let you know that we will be able to send that chart you requested out. I'm going to email it out to everybody on the call right now. So if you want to touch on that briefly, you can.
All right. Why don't we give it 15 seconds to make it across the wire. And the chart you're all going to be getting is this one. Is it starting to pop on your emails?
Not yet. Okay. All right, it's been sent, so people should start receiving it.
I'm going to give it another, I apologize, but let's give it 20 seconds for it all to hit for everybody. So I'm talking about something you can be looking at. Are you folks starting to get it? Just maybe wave your hands. All right, I'm going to assume everyone's got it. Let me tell you what you're looking at. This is the data from the state database. Every hospital in Michigan is required under the governor's order to submit their COVID-19 volume and other data to the state every day. And we do that, and we have, through this complete control of our data. But you can see we de-identified the other systems, and we're not going to disclose that. And I've urged the state to frankly make this database publicly available to everyone, but they've elected not to do that. That's fine, I guess. But the point I'm making here is you can see how much Beaumont has done in Region 2. Region 2 is Southeast Michigan. It includes Detroit. It includes all the suburbs. It includes Ann Arbor. And basically, I think it tells the story of what Beaumont has been doing with respect to the pandemic, getting in early and frankly carrying a very heavy load, which again, unfortunately, has a very big financial consequence. So we wanted to share this information with you. And again, this is the data we're all required to submit every day. And I assume it's all complete and accurate as submitted by all the health systems shown. And with that, now let's open it up to any questions you have.
All right, so I will call down the names on the list here, and I'll start at the top with Beth LeBlanc. I'm going to unmute you.
Thank you, and thanks for holding this. I I guess for folks at home who might be thinking, man, these hospitals have potentially more patients than they ever have before. We've been hearing about how crowded they are. What is causing the hemorrhaging? Is it only elective surgeries, or are there other factors at play that are causing the downturn?
The biggest single thing is the fact that a lot of our surgical revenue and other revenue streams have dried up. They're gone. And so we've eliminated 85, 90% of our surgeries during this period, and frankly, a lot of other procedures. In part, that's because they were crowded out by the pandemic. At Beaumont, we had to increase our ICUs by 40% over our normal complement. That meant we were converting every OR, every PACU, post-anesthesia recovery unit, whole bunch of other locations to be critical care units, to be ICUs with ventilator-dependent patients suffering from COVID-19. So that's a giant piece of it. Another big piece of it is the price of PPE has gone up dramatically. And so what we used to pay $1 for a gown maybe 6 weeks ago is now $6 a gown, and we're trying to get it from all different sources. So the supply chain definitely was not ready for a pandemic, and that's impacted us significantly. The other thing is that non-COVID-19 medical issues, those medical surgical issues, are not presenting to the hospital the way we normally have them. Our ER visits are way down. Whatever the population can avoid, having treated, going to the hospital for, they're avoiding it. So this is a national issue. It's coast to coast. It's why we put in an op-ed that I wrote for the creation of a super fund between 400 and 600 billion to frankly bail out Americans' hospital and avoid the calamity of a lot of them having to close because of the hemorrhaging of cash.
Okay, Chad, we're going to go to you from Cranes.
Yes, John, what does this mean for the pending sale or purchase of that hospital system in Ohio that Beaumont was in the middle of doing before all this hit?
Again, there was no sale or purchase. It was a merger. And so we're just going to combine assets when we put that through. That's the Suma Health System. And there's not a change planned in that one at this point. Both Suma and Beaumont are all hands on deck with the COVID-19 crisis. So we didn't plan this, but we are deferring that until we have a little more clarity about the impact of this crisis. Again, they are doing the same things we're doing. We talk multiple times during the week as they try to navigate through that and their own version of the surge that they'll experience in Northern Ohio.
Okay. Dan Zaharik, do you have any questions, or do you want me to just go to the Channel 7 reporters on here? I'm not hearing Dan. All right. Darren Cunningham, go ahead.
Yes. Hi. Thank you for taking my question here. I'm just curious if you think this could have been avoided, let's say months ago, or if some type of plan would have been in place. If you could forecast something like this happening, could the hospital, avoid something like this, having enough in reserves? I don't know how you would have planned for something like this, but just curious.
Well, I think all of American healthcare, frankly, all of international healthcare, because of the scars of COVID-19, are going to be planning for this much more aggressively in the future. At Beaumont, we had a plan, and frankly, what we had is an inventory of 50,000 N95 masks that we had in our warehouse over and above the stock we normally need. Frankly, for a concern about a influenza-based virus, coming from the Far East and becoming a epidemic or pandemic in our environment. I did that because when I came to Michigan 5 years ago from Emory and Atlanta, where we had the Ebola situation, we took care of the Ebola patients. I learned firsthand the need to make sure you have enough inventory. And so we had much more inventory than most others for what I call the N95 mask. The problem is nobody had planned for anything on the size and scale of COVID-19 in terms of how it was going to consume PPE. And again, this has been written about for a long time. People at the CDC and elsewhere, Bill Gates wrote a very compelling piece in 2015 that this is one of the biggest risks humanity faces when you have the juxtaposition of animals in an unnatural way in these wet markets, trading microorganisms back and forth, viruses and bacteria. You wind up with a zoonotic disease that jumps from animal to human. And then when it becomes contagious human to human, you wind up with a COVID-19 situation. So was it predictable in some ways, but predictable on the size and scale? Our society will never forget COVID-19. And this is the pandemic that I think will reshape our thinking on infectious disease for the next 100 years.
Okay, we're going to Heather Cataldo from Channel 7 next.
Thank you. I have a couple of questions. First off, could you please clarify for us, are any frontline medical staff going to be impacted by the layoffs, meaning nurses, doctors, respiratory therapists, radiology, anything like that? Or will those people be impacted by the layoffs?
There's no one impacted that is needed on the front line. I'd have to go back down the list because we have certain areas where there just is no clinical volume and they may have been impacted because there's nothing for them to do or the volume has dropped off so substantially. Again, this is overwhelmingly a temporary layoff. As soon as the patients come back and we can build back those volumes, we'll want to bring the people back.
Okay, thank you. And I'd like to ask a question about load balancing. When you told the state that you needed to load balance, was the state aware that many of those patients that would be transferred out of your system were on ventilation and dialysis and quite critical?
Yeah, I mean, in this pandemic, we've done a lot of transfers to Beaumont and outside of Beaumont with patients on ventilators. Patients that are transferred on dialysis, often that's a chronic condition. They may be on end-stage renal dialysis and could have been on that for years. It's not uncommon to transfer those patients. We transferred ICU to ICU some patients to the University of Michigan when they helped us out, and we were able to utilize some services that they have, which were better for these patients. So transferring patients on ventilators or with other conditions is something you have to do safely, and you do it in a certain way, but it's done every day, and it's not a totally extraordinary event.
And lastly, the union employees, especially at some of the southern hospitals, Wayne, Trenton, Taylor, will they, if they're affected by layoffs, will their health care coverage continue? Well,
unfortunately, their agreement does not allow for them to have health care coverage. It's very specific about their agreement. And frankly, my view is if they would like what 95% of Beaumont Health is non-union organized and 5% is. If they would like the same arrangement the other 95% have, that means everything. I think we can look at that and probably do it. But we can't allow a situation where they start to cherry pick with respect to, well, we want this or not that, because that's just not fair. And again, we're bound by the terms and conditions of that agreement. And that's classic in a union situation. I don't know why they, in the agreement, they didn't bargain for continuation of healthcare benefits for the employees, but that's what they did. So I can't respond to why they did that.
Okay, we're going to go next to Jackie. Jackie Martin, do you have anything? Jackie?
Can you hear me?
Yep, now we do.
Okay, great. Thank you for the opportunity here. Basically, I just wanted to ask a question, also targeting the downriver hospitals, Trenton and Taylor. And if you could just kind of break down what what those numbers, the 2,475 layoffs and the job eliminations, how much of that is hitting the downriver area?
I don't have those numbers in front of me. I will tell you it's proportioned by the size of the facility. The most impacted facility is Royal Oak. They have by far the largest number of employees, and so their numbers are the largest, and it goes down from there. The next two largest hospitals are Dearborn and Troy. So again, it impacts everybody in Beaumont Health, and it's across the board, but I don't have the specifics to share with you now, hospital by hospital.
Okay, we're going to go to Kristen Seamus from the Free Press.
Hi, thanks for having me. Without a hospital superfund, what is Beaumont's long-term plan? Are more cuts likely? How will you right the ship?
One, we don't want to do more cuts. We think we've tuned the organization for the right number of clinical personnel, staff, others, and what we think is going to happen with clinical volumes. But we're still, walking around in a dark room of a pandemic with unprecedented size and proportion. Some things we worry about now is that now that we've had the initial surge, and that seems to have been flattened in Michigan, which is a great thing to have happened. It means some of our plans that we were scrambling to do, such as the conversion of Wayne to COVID-19, we don't need to do. We can now do our plan that we had all along and take that back to a med-surg hospital. But you hear it in the media, you hear it from the scientists, the risk of additional surges. They could be microsurges, or they could be maybe 80% of the last surge. As the economy goes back to work and the sheltering in place and other orders in various states get potentially removed, the virus is still there. The virus is omnipresent. And so if the virus only exists to go from human to human, and we don't know how that will behave. So the uncertainty of the future for us is significant, and we just have to be nimble and respond and ready to deal with a potential, another incremental surge of some sort. We hope it doesn't happen. We hope our numbers keep drifting down. One very important thing is COVID-19 is a permanent resident in America and frankly the world until a vaccine is in place. So we believe we will be treating COVID-19 patients in all of our hospitals the way we've always been doing it at some level through the rest of 2020 and likely into 2021. And I think that's our new reality, and that's going to impact every business in America. In healthcare, I think we figured it out to a certain extent. And again, in 39 days, we went from, literally in 3 weeks, we went from 0 to over 1,200 COVID-19 inpatients in our hospital. So it moved on us like the speed of light.
Kristen, do you have another follow-up here? It looks like you sent
I
a
do.
message.
I do. Thank you. What is Beaumont's plan with the Wayne Hospital? Will it reopen and when?
Our plan is, and it's always been the plan, we announced it and put it in writing on March 25th and have probably issued 4 or 5 other press releases since then. They've always said the same thing. There's no plan to close the Wayne Hospital. We did convert it and went through the regulatory process with the state, which was we had to do that and get our licensure changed to convert it to a dedicated COVID-19 hospital, which meant no OB and no ER. The reason we did that back in March 25th is if you look at all the modeling for Southeast Michigan, in the first week of April, we were going to crash through the capacity. That means there was going to be no room left for additional COVID patients in Southeast Michigan, and we were going to be just swamped, not dissimilar to the heat that New York went through, maybe even a little bit worse if that had all taken place. So our fastest way to get another 200 beds to potentially dedicate to COVID-19 was the conversion of the Wayne Hospital. It made great sense, and I'm glad the surge mitigated and those orders worked to tamper it down and flatten the curve. So we did not need the Wayne 200 beds for that. And we are now have it being sanitized and we'll be on the process of converting it back. We're going to go to the regulators and say we want to take it back to a med-surg hospital. And we are still going to start to bring on staff to reopen the ER and other functions. And they will be open when we can do it safely. We are always going to be looking over our left shoulder, though, to see what is going on with the COVID-19 pandemic and whether we're going to get another surge or not. Again, there are a lot of moving parts here. A lot of orders, stay-in-place orders, expire at the end of this month. Depending upon how that happens, that can impact the COVID-19 volumes that we are faced with.
Okay, I'm going to go to L. Graham.
Yeah, Lester Graham with Michigan Radio. Just 2 quick questions. How did you determine, I understand the temporary layoffs, how did you determine to come up with the permanent elimination of 450 jobs? And what is the average executive pay cut?
On the first point, we basically went through the organization and said, we're going to be under this cloud for at least 2 years, probably longer, and we are financially hemorrhaging. And we went through and we looked, and it was very difficult, at any position we could potentially do without. And again, we did something where we provided these individuals a lump sum severance arrangement, and we normally don't do that. We pay it out over time. The reason we did that is by doing it lump sum, they can then also take advantage of the very enhanced unemployment benefits. So if you're making $50,000 a year now and you are put on unemployment, you basically, the unemployment benefits will equal a $50,000 a year pay rate. We're also pushing state and federal officials to extend those, which we think they need to do. On the average of the executive salaries, it all depends on where they are. I'm not going to go down the rabbit hole. I don't really have an average calculated for all of them. My situation is very simple. If I made $1,000 this week, it's cut to $300 for next week. It's 70%, and the math is that simple.
All right, we're going to go to Ross Jones from Channel 7.
Thank you, sir. On that front, the cut that you announced today, at least as it relates to you, is, I believe, just to your base salary. Can you tell us what that will take you to?
No, I'm not going to go down all the details. Frankly, those are all in our 990, but it's basically the base salary is cut 70%, and our short-term incentive plan, I'll pick on that, is effectively shut down because we're financially hemorrhaging. And that's an automatic. So you can do the math off of that and out of the tax returns.
Fair enough, though. There's about an 18-month delay in the 990s, as you know, when they're filed. But I mean, based on what your base was in 2017, which is the last one we have, it was about 1.8. Was your base more or less than that for this year?
It's close. I'll let it go at that.
And will you be accepting any payments beyond your base salary this year, whether it's deferred compensation or any incentive or bonuses?
Again, I'm not going to go into details. I don't have any bonuses coming in, nor does any other executive. The bonuses coming in would be for 2020. It'd be paid in 2021. And again, that plan is effectively shut down.
Understood. But just as far as, is all you'll be accepting this year your reduced base salary, or is there any compensation?
Yeah, again, I'm not going to go down the rabbit hole of individual salaries, including mine. I think we've been clear on the percentage, and it's quite real.
No doubt, but if I could just one more time here, because Beaumont has certainly pushed for transparency from the state. Beaumont has been transparent in this conversation regarding patients that you've served. A lot of your employees, as you know, are hurting right now and upset. Is there any reason you can't tell us what your base salary was this year?
I'm not going to disclose that. I mean, again, I said it was close to what was in the 990. Again, it's going down 70%.
All right, we are going to go to Mark Cavett now from Oakland Press.
Can you hear me?
Yep.
Great. How much money will these pay cuts, layoffs, and position eliminations save the company? Do you have that number, John?
Actually, I don't have that in front of me, and I apologize for that. We will get that to you, what I call the annual effect, unless there's a lifeline in the room that's got that number. We'll have to get back to you on that one. I want that one to be accurate, and so you can see it. Again, it's a very dynamic situation because the pandemic changes day to day.
John, just one other question. What criteria would need to be met before these laid off employees are brought back?
The clinical volumes start to return that we can do that. We're scheduling some surgeries, for things that were deferred but are time sensitive, cancer patients, others, where there's tumors or other issues that need to be dealt with, or biopsies. So that's now happening. But a lot of it is, also depends on the patients and their physicians, and whether or not they want to come back now and have that done, or wait. I think people are shying away from healthcare to a certain extent. I've talked to a lot of physicians concerned about patients with chronic conditions that are not being as actively managed as they should be, because people are staying away from the physician office or the hospital or otherwise. Our e-visits are way up. And we're doing a lot of those with our employed groups. I think our private practice groups are also doing a lot of it. But that doesn't, no one is close to getting back to 100% of normal.
Any estimates on how long those layoffs could last?
No, I mean, if you tell me about the virus and how it behaves, that'll give me a lot more certainty on this. Again, we are converting units now from COVID-19 to clean units. That conversion enables clinical programs to come back online, and we are going to do that as quickly as we can. But again, always looking over our left shoulder at the virus and the pandemic, and if it gets additional surges in the population, then we're going to have to respond to that. We've done that before. We did it, again, at incredible speed from March 13th to our high point of April 7th of COVID-19 patients. But again, that's a key factor that will drive a lot of this. And we hope it keeps dropping. It will not go to zero. And we have to keep that constantly in mind.
All right, Robin Erb from Bridge Magazine, Free Press.
Thanks for doing this. Two questions, somewhat related. When you look at the chart and you look at the number of patients you had, I'm wondering what kind of effort was made to redistribute those patients to other hospitals. I didn't know if that was the right call. And then if so, what was the reaction from those other hospitals? And then on a related note, what's been the reaction from the state and the feds as you're talking to them? I'm sure you're having conversations about these budget woes. What's been the reaction from them?
I'm sorry, what were the specific transfers you're referring to?
Sure. When you're looking at the patient loads, when you're looking at the number of patients you had, this whole redistributing patients to other systems, how much of an effort was there, and what was the response from those hospitals?
The response was varied, and there was tremendous effort. I mean, I'll give you a simple example. I think it was the weekend before April 7th, one of our hospitals just got slammed with COVID-19 patients in the ER. The ER waiting room was jammed. There was a line going out the building. It went across the street. The patients were waiting in their cars in the first level of a parking garage. So on a scale of 1 to 10, it was about a 9 or a 10 in terms of how hot the situation was. So we were desperately trying to get emergency room to emergency room transfers implemented. We were able to do a lot of it within Beaumont Health, but we also asked a lot of others to do that. We had different reactions. Some were trying to preserve PPE. Others didn't want any potential COVID-19 patients. I will acknowledge the University of Michigan stepped up and helped us with a number of patients. And it's that variation and reaction that I think is a lesson learned in this, because in another pandemic, it's got to be all hands on deck. Everybody's got to be willing to help. And you can't try to avoid taking care of COVID-19 patients. I mean, at that time, every hospital in Southeast Michigan had COVID-19 patients. It wasn't like anybody had avoided it 100%. But, and again, early on, we took patients from other hospitals before we really scaled up and became the dominant player in terms of treating COVID-19 in Michigan overall.
Oh, sorry, hang on. Robin, hang on 1 second. Go ahead, try talking now.
And mute Alt A. Can you hear me now?
Yep.
I'm sorry, I just want to clarify. So you're saying some hospitals, this was the Farmington site, right? Farmington Hills site that was so packed?
Yeah, well, there were two hospitals that quickly became 90% COVID-19 at Beaumont. The one was Grosse Pointe, and the other one was Farmington Hills. Royal Oak got to over 60%. So, I mean, it was very dynamic. It was moving very fast.
And other hospitals, you're saying, refused to help or refused to take some of those patients. One, because they were trying to conserve PPE, or because they didn't want more COVID patients?
They were both, and I'm going to leave it at that. I think that's something that can be sorted out as we get further into this. But it was, that database that I shared with you, that information and that graphic, it's got a lot of other information in it that shows that every hospital every day is supposed to submit its COVID-19 volumes, how many are COVID positive, their inventory of PPE, their available beds. There's a lot of information in that. And that's what our transfer people look at and say, gee, we're getting clobbered with one of our hospitals. We are just swamped. Can you help? Can you take 3 patients out of our ER? And we look at folks that look like they have room at the end.
Okay. All right, let's go to Rod Maloney from Channel 4.
Good morning, John. Just a couple of questions. The first being, how long can the hospital live with this, or how long can you hold out with this situation? And then I suppose on top of that, it would be, where would you come down on the governor and reopening the state, and what that would mean to helping the hospital cope with these problems?
On the first one, I don't know, because in the month of March, we had 2 weeks of COVID-19, and we lost $75 million on our operations. You might as well consider that cash. and in April it will be worse. So we have the financial resources to absorb that. We did planning around that with lines of credit and other mechanisms, but it's not unlimited. And you know, we are hoping that we can get our other services back online, you know, between now and the fall, and return to the new normal, or go to the new normal of having some population of COVID-19 patients in all of our hospitals, plus being able to do surgeries and other things. The other wild card in this is the government. Only the federal government has the MasterCard with no credit limit on it. Actually, it probably has some limit. We may find out soon. But that can basically help small business, keep the hospital industry from collapsing, and provide us the resources, which is why I advocated for the Superfund. So far, they've distributed some money. We got $75 million in April, which is great. But I can tell you our losses will swamp that easily. And so we will be burning cash beyond that. We don't have clarity on how they're going to distribute the money ongoing. They gave out the first round of money based on your Medicare volume, which I'm not sure is related to COVID-19 work per se, but that was a mechanism that they chose and to move the money out. But they need to do a lot more. Again, I think that Beaumont is healthier than most financially, was going into this healthier than most of the other players in healthcare in America. So that's what we need to be thinking about is, you know, not watching Beaumont. We can't afford to have 25% of the weakest players in American healthcare hit the wall financially out of this. And so, you know, from a public policy standpoint, people need to get organized and say, okay, how are we going to keep the healthcare system afloat and working?
Okay. It looks like Fox 2 is on here. There's not a name. Is there anyone from Fox 2 who is wanting to ask a question? No? Okay. We could take maybe one or two last final questions, unless, is there anyone that I've forgotten? I think I've gone through the entire list here. Is there anyone who hasn't had a chance to ask a question? Okay, are there any other, if you want to type in the chat, if you have a final question, I can take one or two more and then we'll wrap this up. Any other final questions?
Yep, Mark.
Oh, hi, Chad, go ahead.
Just John, this is a follow-up. When you said earlier that the merger with Summa is being deferred, what do you mean by that? Is there going to be a delay? And if so, how long?
We don't know how long. We both delayed it. Again, it's we can't turn a blind eye to the pandemic. Going through the merger process and all those activities, we thought was an unnecessary distraction, given that we're working 7 days a week, 16 hours a day to deal with the pandemic, and so is Summa. So it's kind of like you had a plan to do something, but the house is now on fire. So we're going to deal with the fire.
Okay.
Ross, you have one other question?
Yeah, a number of hospitals, I think, have set up employee assistance funds. Is that in the works? Does Beaumont already have one? Is the Beaumont Health Foundation being used in any way to try to help any employees who either have been laid off or are otherwise struggling?
We do have an employee assistance fund. We've always had one. It's obviously becoming more active. We are fortunate that we've had philanthropy that has reached out and said they'd like to help us. And so we're coordinating that with our foundation. Again, I think that one of the key items is going to be how do these unemployment benefits play out? Because again, a lot of people if you're if 50,000 or below, you're substantially made whole with respect to the with respect to lost income with the unemployment benefits. Obviously, those above that amount are going to be feeling it. But again, the permanent positions are getting severance payments, and again, the others are temporary layoffs. Our goal is bring them all back to work. We really want this temporary to be as temporary as possible and as short as possible.
Okay, go ahead, Robin. You have a follow-up?
Yeah, I just wanted to add, I know you've probably been having lots of talks with the folks in Lansing and perhaps even DC. Are you getting much response? Do they seem to be hearing about the concerns?
Yeah, they're trying. I mean, it's the this is the first pandemic for all of us. So for the most of the American healthcare industry in the United States, certainly for our state government and the federal government. So there's a certain amount of figuring out that goes on. I think that, no one is perfect, though we've made some mistakes, but we corrected them right away and dealt with it. I think that the state government has probably gone through the same. The critical thing is, again, this virus, this enemy doesn't really care about all of that. It's that we've got to be pulling together using the best science and real data to deal with this. And that's the best way to put this genie back in the bottle.